Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Beta blockers. Okay, beta blockers are the drugs which are used in ischemic heart disease. In fact, they are the drug of choice of ischemic heart disease. And among the beta blockers, we mainly use cardioselective beta blockers because if we use non-cardioselective beta blockers, then they will cause side effects, excess of side effects. So in order to prevent it, we mainly use the cardioselective beta blockers only. So the usage of beta blockers is mainly by the benefit to side effects ratio, because the benefits are more when compared to the disadvantages. So we use beta blockers in the coronary ischemic heart disease. So what are the benefits of the beta blockers or advantages of beta blockers? Advantages of beta blockers are of many types actually. First, um, beta blockers will reduce the frequency of angina episodes. They will reduce the frequency of the angina episodes. How? Because these beta blockers will actually decrease the calcium, intracellular calcium, and causes vasodilatation. So thus they will increase the blood supply to the ischemic area, and thus they will decrease the frequency of the angina. Then these beta blockers will also improve the exercise tolerance of the person, while vasodilatation same mechanism. Then they will also slow down the heart rate and they will regularize the heart rate. They will reduce the chances of sudden cardiac death. They will reduce the chances of sudden cardiac death, and thus they will prolong the survival of the patient. And these beta blockers are used mainly as the first line drug, mainly in the treatment of ischemic heart disease. They are used as the first line drugs. So these beta blockers are actually cardioselective beta blockers, or should be preferred over non selective beta blockers to prevent the adverse effects like bronchoconstriction, masking hypoglycemia, and other adverse effects which are seen in non selective beta blockers can be prevented by using a cardioselective beta blockers. So what are the disadvantages of beta blockers? The beta blockers can have relative contraindications, because we should not use beta blockers in certain conditions, especially if the patient is suffering from an angina which is vasospastic or prinzmetal or variant angina. Actually, in vasospastic, prinzmetal or variant angina, beta blockers are contraindicated because the beta blockers will precipitate the vasospasm, so it is contraindicated. Then beta blockers actually block the heart, and that is beta 1 receptors on the heart, and thus they decrease the chronotropic, dromotropic, inotropic effect of the heart. And thus, because they decrease the force of contraction of the heart and the rate of contraction of the heart, they result in bradycardia, and they also cause hypotension also. So they are not used in conditions like bradycardia and hypotension because they precipitate these issues. They should not be used in shock because beta blockers by itself cause hypotension. So in shock also the patient presents with hypotension, so they are not used. In heart block the heart is not able to pump properly due to some intrinsic issues. So as a result, if you give beta blockers again, the heart will not pump properly again, because the pumping will be reduced, and there can be complete heart can stop uh, pumping also because of this beta blockers. So beta blockers are contraindicated in heart block. In acute airway disease, actually especially the cardio selective beta blockers will all the non cardio selective, actually the non selective beta blockers, they will activate the beta 2 receptors, and they cause bronchoconstriction. If they cause bronchoconstriction in patients with the acute airway disease like asthma, then they will precipitate the effect of asthma in those patients. So as a result, the beta blockers are mostly contraindicated in patients with asthma. Then, one important thing about the beta blockers are what are the uses of beta blockers? Obviously, they can be used in ischemic heart disease and they will have maximum mortality benefit in angina. They cause maximum mortality benefit in angina because they prevent the remodeling of heart also. They are also the drug of choice for prophylaxis of angina, and actually for the prophylaxis of angina it is beneficial to give beta blockers along with nitrates, that is oral nitrates along with beta blockers can be given in the prophylaxis of angina. Then one important thing is beta blockers, these beta blockers should not be withdrawn suddenly. We should not withdraw the beta blockers suddenly because when they withdrawn, if withdrawn suddenly, then they result in rebound angina similar to nitrates. Why? Because these beta blockers will cause upregulation of the beta receptors. Because of the blockade of beta blockers, beta receptor, there occurs upregulation of beta receptors. So these upregulated beta receptors will, whenever the beta blockers are stopped, then the normal catecholamines in the body will act on the sympathetic receptors. So even the normal catecholamines may act on the increased beta receptors, thus causing rebound angina in the patient.
Thank you and thank you for watching.